Hi, everyone. Welcome to the IDEAA Lyme disease fundraiser info session. I'm John. If you don't already know, I'm going to be taking you through this tonight. If you haven't seen our first info night about Lyme disease and you're interested, then you can watch it on YouTube. There's a link in the description of this video, or you can go to IDEAA.ca, that's with two A's, and you can find it in the event section. Riley, our guest speaker for that event, was kind enough to share his experiences with us, and I would definitely recommend you watch that. Otherwise, here's a quick description of some of the biomedical aspects of Lyme disease. Lyme disease is caused by a few different types of bacteria. These bacteria are spread through bites from a black-legged tick who is infected. The specific type of bacteria is largely dependent on the region the tick is found in. The ticks hide in tall grass and shrubs and are mainly a risk when walking outside or hiking. Once a person is infected with Lyme, some of the early symptoms are fever, chills, and a rash. This rash is not always seen, however, and it can be difficult to identify for some people. In the later stages of Lyme disease without treatment, people sometimes experience headaches, heart issues such as palpitations, joint pain, and inflammation of the meninges in the skull, causing neurological issues like numbness. Lyme disease is generally treated with antibiotics. This can lead to a full recovery in many people. However, it is very important to catch it early, as this will minimize the risk of experiencing more severe later symptoms. As for prevention, wearing clothes treated with permethrin can help to prevent tick bites. Permethrin kills insects that come into contact with, making it good for this. It can be bought as a spray coating for clothing, or you can also buy pre-treated clothes, which already have it. When you're hiking, it's important to avoid walking in tall grass as much as possible. If there are paths present, then you should be trying to stick to those paths and also walking close to the center of them to avoid being close to the grass. Finally, it's a good idea to check yourself for ticks when you get home. So check all of your clothing, make sure there's nothing on it, and you should also be checking your body all over. Make sure you check, like checking crevices such as armpits is very important, as that's where they can hide. As for the fundraising, the charity we've decided to support for the session is called Can Lyme. They're a Canadian charity which supports those with Lyme disease. So the money donated to Can Lyme goes toward research to better understand and treat Lyme disease, educating people about Lyme disease, and advocating recognition of Lyme disease to governments and academics. So, even though there are treatments available for Lyme disease, charities like this are still definitely necessary. As you can see from the article in the top left here, physicians in Canada do not have a good track record in terms of diagnosing and treating Lyme disease. This has forced patients like Trent Nimeth to get tested in the United States, as he could not find a Canadian MD who would test him. This is not an uncommon experience, and it's a major part of why advocacy for Lyme disease testing is so necessary. Additionally, due to global warming causing overall increases in climate, ticks are able to move further north, increasing the risk of Lyme disease across Canada. This can be seen in the nationwide rates of Lyme being 144 in 2009 and 1,487 in 2018, which is a massive increase. These factors combined mean that Lyme disease research and advocacy is becoming increasingly important, making the work done by Can Lyme essential. So I'd like to encourage anyone who would like to support Can Lyme to donate to them. You can donate to our club on IDEAA.ca or by scanning the QR code on the left here to go to our website. The funds donated to the club between now and our next info night on October 22nd will be donated directly to Can Lyme, so that could be easier for you. Alternatively, you can scan the QR code and go to the Can Lyme donation page and donate directly. We will be keeping track of donations sent to the club and sent to charities, and we're going to have a prize at the end based on who is able to raise the most money and donate it. So one reason why donating directly to the club is easier is because it'll make it easy for us to track it. If you do decide to donate there and you don't want to be counted on there, that's totally understandable, and you're free to just email us. Um, and also, if you donate directly through Can Lime and you want to be counted, you can also just send us an email with proof of donation, such as a receipt, and we'll make sure to count you, and you can be counted toward a prize that prizes that we're going to be giving out at the very end of the year. Yeah, so we hope you're, I hope you're able to donate, and we also, I hope we are able to make it to our info night on Thursday, where Kaylee will be talking about schizophrenia and dissociative disorders. Thank you for your time. See you soon.